Welcome for another special edition of Litter Media Live. I'm your host, Mike Smith. Our interview today is brought to you by the Bean Foundation. And joining us is the Executive Director of Scioto Paint Valley Mental Health Center, William Mahaffey. And William's been on the job now for several months. We'll talk more about that. And that last name may sound familiar, especially in connection with Scioto Paint Valley Mental Health Center. Barbara Mahaffey, former director, is William's mom. So more about all that coming up right after this from the Bean Foundation. The Bean Foundation wants to raise awareness about suicide prevention by sharing 988. Trained crisis counselors are available to talk 24/7, 365 days a year. 988. Save the number. Save a life. To learn more about the Bean Foundation, click on this ad on littermedia.com. We're back with William Mahaffey, again, the Executive Director of Scioto Paint Valley Mental Health Center. I think you told me, William, 10 months.
Oh, yes. Yep.
But you were there in some capacity before becoming Executive Director, weren't you?
Well, funny story. I've actually been there before my birth. My actual own, because my mother did work there back in the early 90s, and I was born in 89. She was working there, and they threw my baby shower at the office. So, and actually some of my first steps were in the floor below the very office I now occupy.
How about that?
So I've been there for quite some time.
Well, I've known your mom for, golly, more years than you've been alive, probably. So, a great relationship we've had with Barbara over the years. And 10 months in, I know you probably are getting settled with everything. But what we wanted to have you in also to talk about is that the month of June is Men's Mental Health Awareness Month, but it's also Men's Health Month, you told me.
Yes. Yeah. Oh, yes. So for whatever reason, they decided to combine everything men in 1 month. Yeah. And then they don't really talk about it much. Right. They just put us all in 1 month, and then they don't like to talk about it that much. But it's something, as the Executive Director of the Scioto Paint Valley Mental Health Center, I'll tell you right now, there's not a lot of male community mental health center directors, period, in the state of Ohio. And it's lessening and lessening. In fact, if you even look at the percentage of the field of social workers and counselors, the clinical staff that is really there to support men and a lot of other people in the community, it went from about, I believe, 85% when I was born to now it's closer to 13 to 18%.
Wow.
So when we start discussing situations where, especially with schizophrenia before the age of 30, 90% of that population that is diagnosed is male. Mm-hmm. And as we know, schizophrenia and psychosis, that is some of the highest amount of dollars being spent because a lot of that goes straight to disability. Right. So when it comes to a lot of different things in relation to our field, it's ever moving. And this isn't just, of course, like I said, with psychosis or just general mental health. This is also health. Stress affects us every single day and affects everyone differently. Yeah. So stress over time, especially when it comes to not just their mental capacity, but a lot of the times their own health is significantly becoming a problem. You look at, men, we die on average 5 to 7 years before a female. Wow. And when it comes to the male suicide rate, upcoming, in September is the Suicide Prevention Awareness Month, which I hope everyone is able to really attend a lot of those community events, which would be fantastic. There's 5Ks, just about a lot of our counties for that. But we, complete suicide about 4 times the average over women. And that is a staggering statistic. You talk about upwards about 75 to 80% of all suicides completed is men. Mm-hmm. So we feel like it doesn't get talked enough, and this is very true. Right. And not just that, but also the prevention efforts when it comes to Men's Health Month. We're 50% less likely to even seek any preventative health care. Mm-hmm. We typically wait till a diagnosis is required to be able to get help. Well, a lot of men in the population, they even refuse to get insurance. They refuse to even kind of speak up whenever they need to. Yeah. And there's a significant stigma with that, as it comes to a lot of professions. Even if you're trying to join the military, there's a stigma when it comes to being able to speak up for your own abilities. Just because if you're trying to get to the military, there are certain disorders that are disqualifying. Right. And even if you want to become a pilot, they'll ground you if you have a mental health diagnosis.
I thought it was ironic when you were talking about, the fact that it's Men's Mental Health Awareness Month and Men's Health Month, but yet we don't talk about it. And that is going to what you're talking about right now, is that for whatever reason, males have always had a hard time of talking about, hey, I'm lonely, I'm depressed, I have anxiety. Do you think we're getting any better at that?
I wish I could say yes. However, I think we're still failing in a lot of areas. When I was born, it was about 3% of the male loneliness rate, kind of indicating that, hey, we really don't have any close friends. Right now, it's closer to 16%. No close friends. And that is a staggering statistic, especially in the age of social media, and we can reach out to anyone when it comes to problems. Even the men, especially, I'm 35, relatively young still, but even men my age, if they come to me either because they're just broken and they have no one else to reach out to, or it's related to, sports, they have an injury, they don't know what to do about it, or it's related to some type of addiction. And thankfully, one thing I truly believe we're improving on is the addiction area. We offer a lot of addiction support for men with our Rulon center right now, which is kind of a 36-bed men's substance use facility. And we really try to kind of be out in the public with a lot of this. When it comes to the jails especially, we have some grants that support us being in the jails to really kind of meet a lot of men and a lot of, basically all of the community where they're at. Often we feel a lot of mental health treatment is reactionary. Yet we know preventative care especially is 10% more effective. When you're talking about what you really want to do, you want to be able to talk about it. And the stigma is significant. If you truly think about it, really the only people you will see willing to talk about it are famous celebrities that are in sports, because of sports psychology, because it's directly impacting their game, musicians, artists in that way, or it's too late because there's famous suicides.
Right.
And whenever it becomes too late, it impacts generations.
I know when, I think he's retired now, formerly with the Cleveland Cavaliers, Kevin Love.
Yep.
There was a big campaign that Kevin helped to get started talking about men's mental health. But, we talk so much about preventative medicine for the physical, but we don't always talk about what would help with good mental health for men. I would think that fellowship, being around people, isolation is very rarely a good thing.
Yes.
Yeah.
Yep. And that's what we really hit on, especially if men can indicate they have zero close friends and they have no idea how to even reach out or speak up. We have a fantastic ability to, now we are one of the main lines for the state of Ohio for our 988 line. Men are able to receive the support at any time. But again, it's fighting that stigma and being able to get people, especially, men in the community, to be able to speak up about this stigma and say that it's okay to not feel okay.
Right.
Is vital. I unfortunately have had many people pass away in my life around my age, around 3 years of my age. There's over 20-something people I know that either have passed away from addiction or passed away from suicide. Right. And out of those 20, I believe only 3 of them have ever reached out to be able to speak up and like, oh, I have a problem.
Right.
And that simple conversation could have really created a complete change and shift to the dynamic of, oh, hey, the community now knows. Instead, we deal with the generations of, oh, we're really struggling. And we're constantly, you see a domino effect as well in the schools. We have, outside of Payne Valley Mental Health Center, the second, a situation occurs in some of our communities, if it happens at the school level, if a suicide happens at the school level, we're some of the immediate responders because that domino effect is real.
Right.
And we always want to be able to, be on the front lines of mental health addiction because these are very real problems. And like I was saying, when it comes to not just schizophrenia, it's PTSD, it's anxiety, it's depression and addiction. All these things are very real problems, and it's okay to speak up. And that's something that heavily needs to be reinforced, not just with, celebrities, but your everyday man.
I know we've talked about young people, and of course that has made a lot of news nationally speaking. I think I was maybe a couple of years ago. Of course, the Bean Foundation is sponsoring today's interview, but I thought there was some information that they put out maybe 2 or 3 years ago that was talking about men, especially in their 50s.
Oh yeah,
There's something about that midlife crisis, if you want to call it that, or whatever, that oftentimes can also lead to suicide.
In fact, not just 50, if you keep going higher, even at 85 and up, that is the highest completion percentage of suicide. And there's something about feeling needed, feeling wanted. And a lot of men, like I was talking about, they don't know how to have those conversations. And once you reach 50, 55, you're expected to be able to handle everything. And there's a lot of men 55 that act the same as they're 15.
Yeah.
Okay. And even when it comes to addictions, when it comes to alcohol is a depressant. Okay. Frequently when it comes to alcohol use and heavier use, by age 55, they're deep in it. They're deep in it to where the point is if they cold turkey it or they leave it completely, it can be deadly for them. So all these things are connected and tied together because you're seeing increased rates of cancer, heart disease, and a lot of other things. When it comes to increased rates of heart disease, well, typically where you guys see those diagnoses in men, when they're forced to start seeing their health provider. When are they going to start seeing their health provider? When either a heart attack situation occurs or a major health concern occurs. Well, it's too late frequently. At that point, we're playing, oh, hey, take this medication and we're going to follow up in 6 months to a year and pray you're going to be okay.
Yeah. I know with, speaking of older people of retirement age, you know, we look so much forward to retirement. I can't tell you the number of people, mostly men probably in fellowship, that they said once they retired, they didn't have anything to fall back on as far as an activity, volunteering or whatever, and they became so depressed. You know, we want you to enjoy your retirement, but maybe there's something that you can do in volunteering or just having a hobby or something that gives you that feeling that I've got something to live for.
And frequently, if you start the hobby when you retire, it's too late. And that's why it's important to have those conversations and start the hobbies early. And frequently when you're talking about, even when it comes to the loneliness epidemic on that end, having those conversations and being able to start those hobbies, you'll meet other people who enjoy those hobbies as well, and you can learn from them significantly. And so being able to have those conversations and be active, it's going to prolong your life. You know, we look at, retirement age with a lot of men. Frequently, a lot of men, once they kind of retire within 3 to 5 years, they pass away because they become inactive. They don't know what to do that excess time. They think it's, oh, hey, I'm going to take, some vacations. I'm going to travel the world. I'm going to really enjoy myself. But we know better. And we know after a year of doing that and then realizing I'm just sitting on the couch watching shows and movies, I'm getting a little bit chubbier and I'm definitely not taking care of my health. Well, what's going to occur? And this is why we see a lot of people in modern times really get a second job after retirement. Yeah. Even if it's part-time, just to stay active and stay mentally feel like they are needed. In fact, we have a few people hired who this is their second job out of retirement, and we support that.
Something that I've seen, I work out at one of the local gyms, that I see a lot of retirement age men and women that are out there. But one of the neat things that I think, it even more so than the physical activity, is how they will take the time to visit with other people that they see there at the gym, and it becomes kind of like a club where they're just fellowshipping. And I thought, I've noticed that on more than one occasion. I thought, now that's even neater than just taking care of the physical body.
And something we've discussed even in my own church, you can really do fellowship anywhere.
Yes.
And when it comes to that fellowship aspect and being able to find your group, find your people, it's not at home unless you're constantly on the internet, and I don't recommend that. No. So be able to feel like you can have those conversations, be able to be public and social. I understand the younger generation really struggles with that right now. Younger generation, even if you give them a phone call, it's very scary. It's all text right now. And that's what we're kind of seeing with over the 988 lines. A lot of, younger generations have difficulty just calling the 988 line. They'd rather text them. And then they find out there's a real problem. They need to be seen or they need to be texted. need to be called instead of texted. That's very difficult.
Yeah.
So being able to be out there in public, whether it's working out, whether it's really going out and meeting new people at a restaurant, a dine-in restaurant, and just saying hi, hope you're having a wonderful day, is fantastic. One of the things I really address with a lot of the clients I've seen previously is when you're having a social conversation with anyone new or anyone you've known for a very long time, when you ask, how are you? We're so kind of frequented into this, we're really pushed into this mode of just saying okay or good.
Yeah.
Doing all right.
Yeah.
When we aren't.
Mm-hmm.
And it's okay to say we aren't. It's okay to say, I've been really tired lately. Mm-hmm. I can't get any sleep. I'm restless over these financial issues. Just having a small, simple statement or simple sentence will go a very long way to supporting a lot of people. But we struggle with just having that one sentence. And because that one sentence, it feels vulnerable for a lot of men.
Right.
And it's a hard truth.
Sure.
It really is a hard truth. But like I said, when someone asks, how are you? It's okay to say, not okay.
What are some signs or symptoms of depression, any kind of mental illness that maybe you're not even recognizing yourself? Mm-hmm. Maybe sometimes somebody else, it's like that you're too close to the forest to see the trees type syndrome. What are some things that people can say, maybe I need to see somebody to talk to?
I always kind of look at the first things that are easiest to spot, and that is, how is your sleep and how are you eating? Mm-hmm. If your eating habits, for example, you're eating a lot, you're binge eating, you're really stressed, you just keep coming home, you just feel like you need to eat, or you're not eating at all, you just feel like there's a pit in your stomach, you just can't eat very much at all. Or your sleep. You want to feel like you sleep all day. You get home, you just want to go to bed, wake up, go to work, go to bed, sleep 10, 12 hours a day sometimes. Mm-hmm. Or you're not sleeping at all because all you're doing is thinking and thinking and thinking. Right. Those are two of the greatest factors to say, oh, hey, if I looked at this from a third party, I'm dealing with a problem. That is a significant change. Mm-hmm. Other things, especially when it comes to depression, you can look at your hygiene. If you feel like, I just don't want to take a shower today, I don't want to brush my teeth, I don't want to do a lot of the basics. Us falling out of routines is very significant. If you're straying away from your coping skills, if you are, because you mentioned going to the gym, if you're going away from going to the gym, it's just like, I'm going to put that off this week. Mm-hmm. And then it becomes next week, I'm just not feeling it this week. That's a sign, okay? If it's lasting longer than a day or two and it's lasting a week or longer, I think it's time to be able to speak out, okay, maybe there's some problems. And it's okay that there's some problems, but you have to talk about it. And there's a lot of other areas. For example, I talked about the thoughts. If you're having racing thoughts and or obsessive thoughts, and all you can do is think about what's stressing you out, and you're living life in the past. We frequently talk about the shoulda, coulda, wouldas, and the must and ought tos. I should have done this. I could have done this. If this just would have happened, everything would have A, B, and C. We do that in sports a lot. Right. If this person just would have made this shot, if this person just would have caught this pass, and a lot of times when we do that, we guilt and shame ourselves, or we guilt and shame others. Those feelings of guilt and shame are directly tied to depression. Mm-hmm. So it's very true to be able to constantly be looking at that self internally, and also be looking at other people when you start hearing these things, because these are not just things we hear, these are things we see out of our friends, out of our family.
William, other than 988, what are some other resources that are available in our respective communities, because you have an outreach over like 5 counties that are possibly tuned in here today, that you can help us with?
Yep. We're in Ross, Pickaway, Pike, Fayette, and Highland. We do some assistance in Greene County with their Department of Youth Services as well. But there's a lot of outreach when it comes to, speaking up. You can Google people. Okay, there's a lot of private practices as well. It's not just us in the community that want to help. Go to community events when it comes to, for example, we have an International Overdose Awareness Day coming up on August 31st. Go to that. If you even feel like you're struggling just a little bit, go to that and meet some people. You will see all the businesses there. There are, telehealth, basically where you kind of call in people or basically video conference people directly who can help. Mm-hmm. Better Health is one of the bigger facilities for that. But we do a mix of both. We do all in office or all over the phone, over the teleconference, or a mix. It really depends on what the person needs, because we're trying to meet the person where they're at. Right. and get that help. And that's, for us, that's not just for mental health, that's also for addiction, and that's at many levels, all ages. And also psychiatric needs. When it comes to, some people, and this isn't just men at this point, it's all populations. Some people feel when it comes to the ADHD or their severe anxiety, or when it comes to their frequently having nightmares because of PTSD, because of, a lot of people in the veterans community, we have a robust VA community here that, we regularly support. We have a lot of psychiatrists. We have 3 child psychiatrists, so we have a lot of CMPs to be able to support those needs as well. There are other places that also do that as well, but when it comes to the breadth of what we try to make sure we offer, we always want to be at the front lines of those things.
Very good. Your email, or not email, your web address, if people want to go there to find some of these resources?
Yes. I always say, if you can remember Scioto Paint Valley Mental Health Center, that's always going to be our acronym. So spvmhc.org. And even our emails end with spvmhc.org.
Makes it easy. Makes it easy.
Simple and easy. And our tech team, Steve Montgomery, shout out to him. He does a lot of work on the website, a lot of work on everything else. And really, sometimes we have to keep it simple.
Yeah. William, good to see you. Welcome to this position. He's 10 months in, but it's first time we've had a chance to visit with you, and tell everybody in the family we said hello.
Will do. Thank you so much.
All right. Again, William Mahaffey. He is the new executive director of Scioto Paint Valley Mental Health Center. Our guest today on Special Edition, brought to you by the Bean Foundation. For Litter Media, I'm Mike Smith.